Hey guys, and welcome to my channel. My name is Princess. I'm a midwife and I'm also a mother. On this channel, we'll be talking about everything: pregnancy, motherhood, parenting, delivery, and everything in between. Actually, we'll also be doing a little bit of health education aside pregnancy, and a little bit of lifestyle, midwifery, and a bit of vlogging as a when. I don't know, a few times actually. Okay, so basically this YouTube is to help all expectant mothers, new mothers, parents experience this beautiful journey as a positive experience as much as possible. I'm here to help you, as one, because I'm a mother and I've been there, and then two, because I am a midwife and I care for people just like you. So do not hesitate to comment, like, and share. And also please subscribe to my channel. So on today's video, we'll be talking about a problem that most pregnant women experience, usually in their first trimester, and that is nausea and vomiting, also called morning sickness. So sometimes somebody may have the urge to vomit and they may not necessarily vomit. Other people also feel nauseated and they actually vomit. It is something that you cannot prevent in pregnancy. When you have nausea and vomiting, know that the first thing you have to know is that it is normal. And it is experienced usually in the morning. That is why it has its name, morning sickness. And most women experience it just when they wake up from bed. With that being said, nausea and vomiting is not something you can prevent. As a result of hormonal imbalances, different hormones are coming into play when you are pregnant, and that brings about the feeling of nausea and sometimes actually vomiting. But I'm here today to actually teach you some relief measures to lessen the signs and symptoms of nausea and vomiting, and ways you can also cope with it through the first trimester. The first thing you'd have to do is to get out of bed slowly. Usually women just wake up from bed when they are pregnant, and then the first thing they do is to go and vomit. It's because you did not wake up or get out of bed slowly. So when you're getting up, turn to your left or right side, depending on where your bed is facing out, and then make sure you are getting out slowly, not fast like you are late and you have to get things done. No, that would trigger the nausea and vomiting. So try that and let's know how it goes. The second thing you have to do is to get a lot of rest. Get a lot of rest. So rest a lot to regain your energy. Ask people to help you with a few things, because it can be stressful, it can make you weak a little bit, and it can be very, very annoying as well. So get some help. The third thing you would need to do is to make some changes in your diet. So if you're a person who likes so much spicy foods and so much oily foods and so much fatty food, you need to switch it a little to some other foods. So maybe taking a lot of proteins and vitamins and minerals rather than fats, and then foods that are very spicy. So if you can, I would advise that you take foods that are bland, so bland foods as much as possible, because it would reduce your nausea and vomiting for you. The next thing you'd have to do is to try to eat something. So I have a few of my clients tell me that when I eat, I would vomit, so I would rather not eat. Yes, of course. Some also tell me that they don't even have the appetite to eat at all. So once they get a food, they just eat all and then they throw up just after, so they would rather not eat. Please try to eat something. So when you are pregnant, you wouldn't get your appetite like when you weren't pregnant. So if you're expecting to be able to eat large bowl of whatever food, it could be a large plate of rice, plate of whatever, you wouldn't be able to eat that. So make sure you are eating small but at frequent intervals. Please eat something. whatever you feel like eating. Once it's not going to harm your baby, once it's not a non-nutritious food substance, please make sure you are eating that. So eat in bits and at frequent intervals. So eat that banana, eat that pineapple, eat that watermelon, eat that salad, eat that vegetable, whatever meal you feel like you want to eat, please eat it. Eat something rather than avoiding to eat at all. Okay, the next thing I would also advise you do is to brush your teeth. If you maintain good oral hygiene, then your nausea would be reduced. Some people tell me that their nausea is usually triggered when they brush their teeth. Yes, I've also experienced that before. So what I would advise you do is that don't brush your teeth on an empty stomach. So when you wake up in the morning, instead of just going to the washroom to brush your teeth or going to the bathroom to brush your teeth, hold on that. Just rinse your mouth, get some breakfast, and then eat, and then wait for some time before you brush your teeth. I would also advise you get a very soft brush, like the one for the toddlers. So very soft. And when you are brushing your gum, please brush it very slowly. And then when you get to your tongue, also brush it very slowly. And if you do this, the nausea would be lessened. The next thing you'd also have to do is to take in a lot of fluids to stay hydrated. So drink a lot of water. If the water alone feels very boring for you, you can add a little bit of lime, or you can add a little bit of ginger to it, and then you can sip it throughout the day. The next thing you would have to do is to avoid anything that triggers your nausea and vomiting. So it could be an activity, it could be a smell, it could be whatever. So whatever, just pay attention. Sometimes you go to a particular place or you smell something and then you just have the nausea and then it follows the vomiting. So avoid every triggers. Once you realize that this triggers my nausea and vomiting, then please prevent it. It can be your perfume that you were using before your pregnancy, it can be your body cream, it can be anything. Please avoid those triggers as much as possible. You can also take bites of some dry biscuits. It's also known to help relieve nausea and vomiting. Ginger is also known to help lessen the symptoms of nausea and vomiting. So you can slice a little bit of ginger and put it in a Ziploc bag on the go. So you put it in your mouth, and once in a while you take what's in your mouth out when it becomes slippery and replace it with a new one. So if it's in your mouth, you are just sucking on it like you're sucking on a candy. So you kind of squeeze in a little bit of the juice inside of your mouth, and it gives that very minty thing. It doesn't work for all people, but it works for a lot of people. It actually worked for me as well. So you can also try the ginger trick as much as possible. You'd also have to prevent wearing tight clothing. So wear loose clothing to help you prevent or minimize the signs and symptoms of nausea and vomiting. Remember, in the beginning of this video, I mentioned that nausea and vomiting in pregnancy is normal, but sometimes it can be abnormal. So you have to just rush to see your midwife or to see your doctor if you have nausea and vomiting that persists throughout the day, or whenever you eat something, it requires that you throw up just when the food gets into your stomach. You'd have to see your doctor. Or sometimes if you have to vomit and then the vomiters is dark brown, or you see blood in your vomit, then you need to also see your midwife or your doctor. And if you also realize that the vomiting has made you feel a little bit feverish, or you feel dizzy, or you have episodes of fainting, then you need to see your doctor, who would prescribe some anti-emetic medications to stop the nausea and vomiting. You may also need rehydration with IV fluids. So please, if you see any of these signs, rush to your doctor. Please do let me know how the remedies that I mentioned earlier helps you. don't hesitate to let me know whatever problem you may be facing at any point in time during this pregnancy. Thank you so much for subscribing. I would actually be doing a new video every week, so I'm not sure you'd want to miss it. So please click on the bell there so that whenever I upload a new video, you'll be part of the very first people to see it. Don't hesitate, please, to let me know the things that you may want to talk about in my subsequent videos. Thank you so much. Until then. Woo!